Hello and welcome to Two Sisters of a Certain Age Conversations with a Therapist and a Doctor. I am your co host, Judy Grant, licensed marriage and family therapist.
And I am your other co host, Dr. Sophia Grant, board certified pediatrician, board certified child abuse pediatrician.
So, Candy, what's new?
Well, you know what? I went to 3 reunions, in the past couple months. It
Mhm.
was elementary school, college, and medical school, and it's been 30 years since I graduated from medical school,
Mm,
and I cannot even believe that because I was, 22 when I started medical school?
I remember it
So,
like it was yesterday.
I know, crazy. What is so wonderful is that today we have a special guest on who is my medical school classmate, Dr. Kimberly Claudette Hutcherson. And Kim and I, we were partners in gross anatomy. So we spent many hours dissecting the body. And I think there were some tears shed also. Well, on my part for sure.
On my part.
And it is a thrill to have Kim on the show. Welcome, Kim.
Thank you all. Thank you for having me. It's so good to see you, Sophia and Judy. Oh, Candy, excuse me. Family
Yes,
name.
yes. Uh-huh.
And
It's a
Judy.
pleasure to have you, Kim.
Thank you.
So, Kim is, first of all, she was like a math major, something really
Yeah.
intimidating in college. Like, I'm like, I was a Spanish major. Not that it was, but yeah, she was a math major, and then Kim went on to become a radiologist. Can you tell us a little bit about your journey, Kim?
Sure. Yeah, I do remember those days in gross
Oh
anatomy.
my God.
He was a psychiatry patient. He was very thin, though, so it was very nice
Yeah,
for us.
yeah, it was easy to
He was,
dissect. Yeah.
he was a good guy. We had a great radiology. What's it, Dr. Thompson's his name? Um,
Thomas, or I think it was Thomas, and
Thomas? Okay.
just for our audience, he was Jamaican.
Yes.
So
Anyway, he
Always have
was
to bring it
it
back.
always
always
bring
has
that
to
up.
come back to Jamaica. Uh-huh.
Always. Anyway, he was very influential in just telling me how radiology was so important in every aspect of medicine. And so that kind of combined my love for anatomy, biology aspect, because I was a TA that summer, the first summer after gross anatomy, a teacher's assistant that summer for gross anatomy. So I was like, oh, anatomy, I can do this. This is going to be fantastic. And so that transitioned into me going to my radiology program at University of South Alabama. I'm from Alabama, so that's in Mobile, Alabama. And then so loving that, I didn't quite know what I was going to do afterwards. And uh, a girl she was a senior that year. She was doing a women's imaging fellowship up in the University of Pittsburgh, but decided to stay and not do that. So I was like, oh, well, let me go up there and interview. This sounds like a fantastic thing. So I feel like somehow I've been lucky throughout all my transition. I interviewed at one medical school, got in, and I interviewed at one fellowship program, got
Yes.
in. So
Uh-huh.
I did my women's imaging fellowship at the University of Pittsburgh and McGee Women's Hospital. And so that was that whole, it's all of women's imaging, not just breast imaging, but half of it was breast and the rest was women's imaging. And then afterwards, I said, well, let me come back home, but I don't want to come back to Alabama. So I
Mhm.
was like, oh, a girl, once again, leaving her program at my hospital, was coming back to Pittsburgh. And I heard about that and said, oh, well, let me go interview there. So one interview, one job, and I've been there ever since. So it's
Wow.
amazing how life has, blessings many ways over that
Mhm,
have
mhm.
transitioned me into it. Opportunity presents, and I just end up doing that. But
Right.
I really, really enjoyed breast imaging and the fact that, excuse me, some people think that excuse me, radiology is just in a room reading, reading films, not
Mhm.
interacting with patients. But with breast imaging, you are 100% interacting with your patients. There's a constant conversation, presenting the issues to women, doing interventional procedures that I do for biopsying lesions,
Mhm.
notifying them that they may have breast cancer or everything's fine, benign, see you next year, kind of thing. So it's been really uh, you know, a pleasure on both sides where I get to interact with the patients, but also get to do a lot of obviously the dedicated breast imaging that I do.
Right.
So Kim is the director of the breast imaging center of her hospital now for
Yeah.
how long?
1999, what is that, 23
Oh
years?
my gosh.
Yeah,
Wow.
Yeah.
yeah,
Yeah.
Wow.
a long time. Medical
Yeah.
director of breast imaging intervention, Northside Hospital, Gwinnett and Duluth, so
Uh-huh.
here
So
in Atlanta area, suburbs of Atlanta.
so she's a badass and
Sounds like it.
and then tell us about mammograms and when the recommendations are for mammograms. You
Yeah,
know,
so
the
that's
age
always
when you start.
exactly. So always a controversy. It's always been, the USPS service, they put out a new thing saying, you can start at age 50, 40 now instead of age 50, which it was. But let me just say and that's not every other year. So American College of Radiology and the National Comprehensive Cancer Network, which is NCCN guidelines, which is how we practice medicine, recommends beginning annual mammograms at age 40 and have them annually every year,
Mm-hmm.
not every 2
Mm-hmm.
years. Because when you do that interval cancers can develop. Then
Yeah.
they're not caught early. They may
Yeah.
be advanced. It may be harder for us to treat. And, you don't want that situation. So, obviously, if you have a strong family history of breast cancer, like your mother had breast cancer at age 40, recommend beginning annual screen mammograms 10 years prior to the age of onset. So you would actually start at age 30.
Right.
Okay.
But I can't say it enough, annually come in every year about the same time and, don't miss,
Yeah.
because that's what happened during COVID. People were scared to come in,
Mm.
they weren't getting out of their house. And so by the time they came to us, we had so many locally advanced cancers. They
Uh-huh.
were there the year before, I'm sure, while they were, just
Mm-hmm.
dealing away. And then it was advanced into a lymph node or something like that.
Oh my
So,
Right.
yeah,
gosh.
it's really important.
Wow.
I schedule my annual mammogram in my birthday month.
Yeah.
So for me, March, birthday mammogram, those two things go hand in hand. So I don't ever forget it.
Yeah,
And it's just so important to get that on your calendar and to be proactive in your own health and do this for
exactly.
yourself on a regular basis.
Right.
I
So
agree 100%.
Kim, you are a breast cancer survivor. Can you
Yeah.
tell us a little bit about your mammogram?
Sure. So, there are basically four views to a mammogram. Each breast gets the craniocaudal view with CC view and this oblique view, because everything in radiology is two views to see things and know where things are. So, we had just switched to digital mammography. Back then, we had screen films where you had to develop film,
Oh, yeah, I
and now
remember that.
we're
Right.
even more advanced. We'll talk about tomosynthesis in a little bit,
Mhm.
but we had digital mammograms, and so you could take the picture and just walk around, look at the monitor. But I actually had focal pain,
Mhm.
and I was seeing patients that morning. I was like, oh, just had a mammogram 7 months prior. I started at 35 and 37. Back then you could start at 35, but now it's like
Mhm.
40. Nonetheless, I wasn't 40 yet. I was a little shy of it, but well, actually, I was 40. And so I had that focal pain. I was ignoring it a little bit during the day. And finally, my tech was like, "Oh my gosh, Dr. H, just go get a mammogram." I'm like, "I just had one. It was negative. I'm fine. Let
Mhm.
me go do it anyway." So I went around, took my picture. I'm walking around with the top off, looking at the monitor with my staff, and I was like, what is that little tiny thing right there? So we finished it on up and went ahead and did an ultrasound. And then I went and asked my colleague, I was like, hey, can you look at this right here and do a little biopsy? And this was a Friday afternoon on
Mhm.
February 22nd, 2007.
Uh-huh.
And, I know I've been doing this at that time for many, many years. I knew what I was looking at. But, in my mind, I'm like, well, maybe this time, maybe I don't really know. Maybe I'm just,
Right.
looking at something. So, yeah, when you
So,
know, you know.
Kim, you diagnosed your own breast cancer?
I diagnosed my own breast cancer.
I mean,
And
what was that like? I mean, like, I
Mm.
can't even imagine what was going
yeah,
through your head. What did you
um,
think? Were you in
I know.
denial? Were you in
Oh,
denial?
no, I wasn't in denial. I was just praying that this time maybe I was wrong,
Okay.
because I knew that so many times I prayed, okay, every time I look at a mammogram, in the back of my head, I'm praying, God, please, help me see everything. Don't let me miss
Mhm.
anything. That's just the worst, to
Mhm.
see a missed cancer.
Right.
Mm-hmm.
And so I knew it was very small. It was something that was new. And the ultrasound told me everything, because when we do ultrasound a mammogram just has black and white colors.
Mhm.
So white area can be a cyst, it can be a mass, it can be, it's just white. The glandular tissue is white. which can hide cancers,
Right.
and there's fatty tissue. So with ultrasound, I could see that the borders were irregular, the margins of it, and I was like, okay, this is not right. So my colleague went ahead and did the biopsy, and I had to call to get orders, for my doctor. And all of a sudden, people just show up at the department. Kim's getting a biopsy. What's going on? What's happening? And I was like, yeah. So my friend I on the way home, it was a Friday afternoon. I called my sister, LaDonna, and she's like 15 months older, and it's just the two of us, like you. And so I said, well, I had a biopsy today, and I think I have breast cancer. And so she's like, oh my gosh, I'll be there. I'll be there as soon as I get the kids out. So she got to my house about midnight that night. And then the following Saturday morning, February 23rd, my friend, a pathologist at my hospital, she called me like 8 o'clock in the morning because everybody knew. They were just like,
Right.
they're looking at it first thing.
Mm-hmm.
And she's like, yeah, Kim, it is positive. It's, grade 3, which is a high grade invasive ductal carcinoma.
Oh my God.
So it was very small. I knew it was less than a centimeter. It was just a couple of millimeters in size, but maybe it was a centimeter. Yeah. But yeah. And at that moment, you're just like, life is like, you just can't even breathe right. You're just like, your heart's beating fast. You're like, I can't even believe this is happening. Because, I dedicated everything I had. I almost felt like I was breast cancer. I'm like,
Right.
I've been doing this. I developed this program. This is just, all I do all day long is, develop this breast program to try to take care of these women. And here I am about to go through the same process. So it was just like, okay. So you're just out of your mind. Your life's flashing. Everything's happening in front of you. And then finally I just had to calm down. I was like, okay, I can't do anything about this. It is what it is. And now we just need to figure out how we're going to treat it. So I just gave it to God. I was like, you handle this. I'm going to do what I do.
Right.
So I just, at that point, started calling my friends who are doctors, surgeons, and, getting in and doing additional imaging with breast MRI to see if it was anywhere else. Pick a surgeon, pick a date, make a decision about what kind of breast surgery I wanted. And I spoke to several doctors. I spoke to several surgeons. I spoke to several medical oncologists because I was like, my tumor was actually what they call it's they test biological markers on the tumor. So once they get the type of cancer, the grade of the cancer, grade 1, 2, or 3, then they test it to see how it responds to medication. So it can be responsive to hormones, estrogen and progesterone, and this antibody called HER2/neu. And so mine was actually ER/PR negative and HER2 positive. And HER2 positive back in 2007, it had just a drug called Herceptin, which is targeted therapy towards that particular HER2 on the cells, that was just released out of trial like maybe a year before. And it was really for metastatic breast cancer, metastatic HER2 positive breast cancer, brain mets, people always died. It was just like, it was not a good cancer to have, even though it was so small. So thank God that drug was available for me. And they were taking another drug out of the regimen called adriamycin. So I'm like, are you sure? So that's why I talked to 3 different medical oncologists. They just wanted to put me on the 3 TCH, which is taxotere, carboplatin, and Herceptin. And it's Herceptin's like for the whole year. You have to do that. So I was like, okay, let's do this. So I knew the type of oncologist, type of medication I wanted. Then I just had to go with my surgeon. And, I went with a surgeon I didn't actually know the surgeon, but I knew this radiologist had breast cancer the year before, breast radiologist, and she chose those particular surgeons. And surgeons, we always choose what radiologists choose. We know everything, we see behind the scenes. We see things that mess up. Everybody's like, what neurosurgeon should I go see? Ask the neuroradiologist, So what breast surgeon should I go see? Ask the breast radiologist. So I chose these doctors. It's Northside Atlanta, which is now part of us, but at that time they were a separate hospital system. So yeah, and then back in the day, I said, if I ever got breast cancer, I'm getting both breasts taken off. We're not gonna, because I just know I would not want to follow my own breast. I mean, I was young; they were dense, dense breast tissue, where it's just a lot of white. I can't really see the cancer. It was barely seen this time. It was like in some fat on my left side, just behind everything. And I'm like, I just want skin-sparing mastectomies. We can do a nice little tummy tuck where they do a free flap. They do a tummy tuck and give you new breast. And so it's my skin. I still have my own skin. I just had to fat and a little bit of muscle and the blood vessels from that put in the breast tissue. And they grow with you. Like when you gain weight, they gain weight.
Uh-huh.
When you lose weight, so it's actually kind of a nice little alternative for having implants if you have
Right.
the ability to do that. Yeah.
Right. So, Kim, you ended up getting, I mean, there are lots of approaches to take. I mean, you can get a lumpectomy. Some
hmm
people will get chemo to shrink the tumor and then do surgery.
hmm
What did you decide?
Yeah. So that's really a kind of I always say it's a shared decision between the doctor and the patient
Mhm.
because they present them with information. Now, sometimes now, if you're HER2 positive, they actually want to give you chemotherapy up front
Mhm.
and then you do your surgery. So it's kind of driven from the biological markers. But back then, we didn't know that information. We
Right.
didn't know we were supposed to be doing that. And so at that point, it was surgery first, and
Mhm.
then what they call adjuvant chemotherapy.
Right.
Neoadjuvant chemotherapy is the chemotherapy given before you have surgery. Many times now, it is because they are HER2 positive. It is because the size of the tumor is too big to take off, uh, you know, be able to close the skin safely, or you have locally advanced disease and lymph nodes are advanced and they want to shrink everything down. It's actually a nice way for them to see if the cancer is responding appropriately to the chemotherapy that they're giving, or even not necessarily chemotherapy. It could be hormonal therapy. Some
Mhm.
people are given the anti-hormonal medication because their tumor is so ER/PR positive. That's the main response that's going to happen. And then
Mhm.
they'll test the tumor. They do oncotype DX, which is a gene mutation checking the tumor to see if it's even going to respond well to chemotherapy. Some
Mhm.
people don't even get chemotherapy. Their
Right.
tumor has a very low response. They just give them the hormonal therapy and they do fine with that. So now it's each treatment response or treatment for patients is very driven, targeted therapy for that particular patient. It's not,
Right,
Individualized.
right.
one shot fits all.
Right.
Mhm.
So
Mhm.
for me, it was like I need surgery first,
Mhm.
and I decided on the skin sparing mastectomies, and I was stage 1, early stage breast cancer. Sure, it was an aggressive type of tumor, but it should have just been a very simple, mastectomy, take out a few lymph nodes, call it a day. Test the lymph nodes. Just should have
Mhm.
been sentinel lymph node. But my surgeon got a little bit more aggressive and did really kind of a level 1 lymph node dissection. So I had like 11 lymph nodes taken out. I'm like, what the? This is not complicated. We've been
Right.
doing sentinel lymph nodes for years,
Uh-huh.
years. And I'm like, okay, this did not happen. It did. And then I remember that was my surgery was March 15th during spring break. So everybody could be there, the family and all that. And then I started chemotherapy delayed because um, uh, I had some imaging to determine if make sure I didn't have anything else in the body,
Mhm.
MRI and CT and
Mhm.
all that, and then
Make sure it hadn't spread.
Right.
exactly
Mhm.
before you start the trial, and so then they saw these everything was clean except for I had surgical sponges in me.
Oh, dear
They
Surgical
God.
left some
sponges?
Yes, they left foreign bodies in my body. You do a sponge count in the OR, and they're like,
Right.
oh
Right.
yeah, we did have two sponges, but we just couldn't. I mean, oh my! They took an X-ray. The radiologist read it as negative, and I'm like, I went down there, pulled the film, held it up in the hallway. I was like, oh my gosh, they're right here.
Oh my
Yeah. So
God.
they had to take the surgical sponges out. Then
So
I
now
had to
you have to
heal
have a
from that.
second surgery
Yeah.
to
Yeah.
get the sponges. Okay. All
Exactly.
right.
It was crazy. So I'm
Yeah,
like, they're
sounds
like,
like
oh,
it.
it only happened because you're a doctor. I'm like, no, it happened
What?
because I don't know what they were doing. People always say crazy things like that.
Mhm.
So here I am, like, okay.
That's
So I was delayed
awkward.
starting chemo. And then on June 19th, I remember it well, my little thumb started getting puffy. I'm like, why is my thumb swelling? And then I knew what it was. It was lymphedema. So lymphedema comes from when you have a disruption of lymphatic flow to your
Mhm.
body. So lymph nodes were taken out, which means my arm is going to swell, and my hand. So you can see one hand's bigger than the other. This one's
Mhm.
bigger than this one, and it goes all the way down. You can see my wrists. This one.
Mhm.
So yeah, I usually wear a garment, a sleeve, to protect my skin from any type of infections, and also to keep it confined to a certain size.
So you keep it
So
compressed.
yeah.
So so you had sponges left in and you had lymphedema. Did you ever run into the surgeon in the hallway And if yes, did they make eye contact with you? Like, how do you
Uh,
like, that's the
it,
definition of awkward.
it's yeah. So when I
Like
went back to see her and
malpractice.
told her, it
Mhm.
oh no, I did a little something. She had to think about it for the next 5 years. So did you ever get sued? I'm like, yes, you did, because I was just angry at that point in time. Like,
Yeah.
this was not supposed to happen,
Right.
and it
No.
wasn't like it was a huge amount of money, or it's not even the point. I knew I wasn't going to get anything out of it. Everything was capped, but it was like, I just want you to be aware. Don't do this.
Yeah.
Don't be overly aggressive. Don't leave surgical sponges behind. Because I'm not sure I would have gotten lymphedema if they hadn't had to go back to take out the surgical sponges.
Right. Right.
It's always a risk when you disrupt the flow. I mean, you can get it from
Mhm.
one lymph node, really.
Mhm. Mhm.
But nonetheless, then I was like, okay. So yeah, I was delayed with that. So then I finally started my chemotherapy
Mhm.
regimen for a whole year, and I think at one time I had PR positive. Maybe they thought it was, and so I was on some anti-hormonal medication, but it was giving me severe joint pain.
Mhm.
My oncologist would catch me getting out of the car walking like I'm 95, and he's like,
Mhm.
"Why are you not telling me you're in pain?" I'm like, "Because I'm young, I can take it." He's like, "No,
Uh,
we have other medications,
Mhm.
or we just
right.
take you off." I'm like, "But I
Wow.
want to do everything right. You just want
Right.
to do everything they
Right.
tell you to
Right.
do."
Right.
Mhm.
Yeah, yeah. So it was
Wow.
insane.
So, what was your chemotherapy journey like?
So that was a little harsh. Yeah, that was my hair was already short, but I
Mhm.
actually was it short that did? Yeah, it was. Maybe not this short. Nonetheless, I did the first round and I was like, oh, okay, that's interesting. And the first dose, my oncologist wasn't there, so I was seeing one of his partners. I didn't he was supposed to give me for some steroids to take,
Mhm.
but he didn't give it to me. So here's the port. I was awake for the port, by the way. So my friend put my port in. I was like, I'm at work. I'm like, just go ahead and put it in. And so he tried to put it in on this side, but I had a little blockage because actually in medical school, remember I had that teratoma,
Yes.
that benign.
Yes.
Yes. So and when we were graduating from medical school, who knew? I was having a little cough, and I was like, "What is that?" And so I had a mediastinal teratoma, which is, those you don't know, it's like they say it's like a twin. It's all these cells, like teeth and hair, and it's weird
Yeah, like
and
stuff.
things like that.
Yeah.
Yeah.
Ooh.
So
Mhm.
it's in my chest, and so when they took it out after I graduated medical school, at my hospital that I trained at in Birmingham, he kind of irritated the phrenic nerve, so my diaphragm was elevated on one side, which it's
Mhm.
fine. It's been that way forever, 30 years. And but who knew that I had blockage in my subclavian vein from that
Mhm.
same operation? So he's like, I
Wow.
can't get in. And so
Mhm.
he had to put the port on the same side as my cancer, which normally you
Uh-huh.
don't do.
Right.
So anyway, I'm at work, he's putting it in and he's like dilating the track, and it's like, the hose gets bigger, starts small, it's like 8 French by the time he's jamming in there. I'm like, okay, I don't have any drugs because I didn't have anybody to drive me at that point in time. Can you please hurry up? He started talking about American Idol. I just remember all this craziness. I was like, okay, my port's in, thank God. So then I start my chemotherapy, and the first day, my sister's there, my little niece who's like 1, and so we're in the room by ourselves.
Mhm.
And so the first drug goes in. I'm like, what is that? My whole body was like cringing. I mean, literally, I was in so much pain. And he's like, what's going on? I'm like, because do they give you the steroids? I'm like, no, I don't have any steroids. He's like, oh, turn it off. Seriously. So they had to give me IV steroids. And then they gave me the drugs. I was like, okay, I survived that. So the first week, you're like nauseous. It's weird. Second week, you're like, okay, I'm a little bit better. Third week, you feel fine. And then
Mhm.
they hit you again. So every 3 weeks, you have
Right.
these drugs. And so they do it 6 times. And so the first and second round, I was good. I mean, my hair was coming out a little bit, but not really. So I just kind of shaved my head, but I had a little buzz. It was kind of
Mhm.
cute. It was just nice and low, and I was
Mhm.
like, oh. And he's like, oh, are you gonna stay with that? This looks really cute. I'm like, oh, thanks. But then by the third round, you keep on getting additive effects. So it's
Right.
not like
Right.
everything hits you at once. It's just like
Mhm.
they're killing cells, and so.
Yeah.
But then
Right.
you're getting little sores in the mouth. Oh, I had braces on then, by the way.
Oh
I
my
had just gotten braces on my teeth.
Mhm.
And so I only had them on like 6 months when I had diagnosed myself. So as I'm getting these little irritations in my mouth from the chemo, because anything that's that mucosa that grows quickly, like the
Mhm.
mouth or your GI tract or your nails or your
Mhm.
hair, that's what sloughs and falls off. The
Mhm.
chemo's killing those cells faster. That's why you lose your hair and your nails get weird looking and
Mhm.
darkened, or you may lose some nails, or you have GI issues,
Right.
so yeah, so the little sores in my mouth with the braces on, it was a hot mess. So I was like, this is just not cute. And I had, I remember I went back to work, like maybe after the second cycle, and because I can't count, we have 90 days, but somehow I went back at 60. I'm like, how did I miss a whole month? I probably because they just needed me back, So here I am in the back room. They're sterilizing it for me. I'm just reading screening mammograms, and I would stay like a half a day. And then one of my older colleagues, he's retired now, he would say, Kim, you should try to stay a little bit longer. Just build up your stamina. I'm like, okay. So by the fourth or fifth round, or sixth round, I'm really like staying pretty much the whole day. I'm starting to see patients again. I have my little wig on. It's a cute little short wig. And it was hot, though. It was during the summer. So I take it off and put the fan blowing on me. And then I have to go see a patient. I put my hair on, my text. I'm like, fix my hair, make sure it looks okay. And I would go and see patients. But I think in the long run, it was probably better that I was doing that because I didn't have time to dwell on me.
Yeah.
Right.
I didn't have, and the patients didn't know
that
I was going through this. It was very odd when I think about it, because I think back and I'm like, you were literally going through the trenches, but you were still in your passion helping these patients and diagnosing more breast cancers. And they didn't know any different because people wear wigs every day. I didn't, but I was like, when I went out in the real world, I realized nobody even sees me. They don't know I have cancer or going through chemotherapy.
Right.
So it's very interesting thing to go through it and realize that people really just don't know unless you have a scarf on your head or you're walking around, bald, then they know you're going through treatment. Yeah.
Right.
So how long did the chemo last?
So that was 6 months on the chemotherapy. And then the Herceptin I took for a whole year. And then I was on this other trial drug called Avastin, which they don't use anymore. It was just something they were trying back then. So that was part of a clinical trial just to see if that would make sure it would be gone forever. So yeah, but after you're about maybe 2-3 months in, your hair starts coming back. But I came back like pure white. I had white hair.
Are you serious?
Like, oh, white hair.
It's like in Poltergeist after the monsters.
And I remember calling my oncologist, like, can I dye my hair? I think he may have hung up on me. He's like, yes. I can't go out in the room. And so I dyed my hair. And that's probably when I started putting mousse in it and curling it up. Because I think I used to get, it was just short, but I did put what they call the creamy crack in there. I was straightening it and, doing all that stuff. But yeah, so it's been a journey.
Your health now?
Health now is very good, excellent. Actually, I think I have an appointment Monday. So you see your oncologist for the rest of your life, by the way. So I always tell people, your surgeon you're going to see for a hot minute. Maybe if you have a lumpectomy, you're going to get local control of radiation. But your medical oncologist you will see forever. So you need to like them.
Right.
So, the first couple of years, you're seeing them every 6 months, for 2 years, I think. And then it stretches out to a year. Right. And so I'll see them on Monday and they'll do their little thing and write orders from. I actually still get a mammogram, which is, I always tell people.
But it's not breast tissue.
There is still some breast tissue there.
Okay,
so
all right.
People think because you have a mastectomy, you don't have any breast tissue left. Your breast cells go up here. They go down on your side. They can go down your abdomen area. So even though they scrape out the majority of the breast tissue and they replaced it either with an implant or like with me, which they call autologous flap, which is meaning using part of my body so you can use your fatty tissue from your latissimus muscle or your gluteus muscle or your abdomen and then get the breast tissue. If you put that tissue between your skin, which is here, and the implant, the flap goes in, and then behind that is your pectoralis muscle. So cells or residual breast tissue is left on your pectoralis muscle. It's also left on the skin. And of course, it's very minimal that anything's ever going to happen to them. So, but unfortunately, I have seen recurrences on the pectoralis muscle,
really,
or on the skin. And so when people, a lot of times the patients feel it, even when they have implants, it'll come in the midline where the residual breast tissue is. They're like, I feel a mass here, and I'm like, and you're looking at it, and you're trying not to hurt their implant, but it ends up being recurrent breast cancer. Where there's residual cells. So I'm like, if you have an implant, I can't see anything. But if you have the fat, your body there, I can see it. So I've always recommended having annual mammograms, even of your flaps.
Okay.
because we can see changes that are early changes of breast cancer there.
Right.
That's good
Yeah.
information.
Yeah.
I feel like I've been on this call with either this quizzical furrowed brow or my mouth open in like shock and dismay.
Mm-hmm.
So it
Yeah.
wasn't just the breast cancer that you had to contend with. It was all of these other issues that
Yeah.
created this, perfect storm.
It was. I think back and I'm like now talking about it because I had talked about it probably maybe 3, 4, 5 years out of it. I started getting invitations to speaking engagements because I knew I was a
Mhm.
breast
Mhm.
radiologist. I was a breast cancer
Mhm.
survivor. So we'd have local fundraisers, the Hope Fashion Show with American Cancer Society, or different articles, local articles, and then even some other speaking engagements. And so I was talking about it a lot back then, but I haven't. That's why I thank y'all for actually having me here today because I haven't spoken about it in so long.
Mhm.
Because after a
Mhm.
period of time goes by, you don't, you just go on with your life.
Right.
Life
Right.
goes back to kind of normal, and you don't really think about what you actually survived
Right.
Right.
to get to the point you're actually thriving now. And it's
Right.
like it's a
Yeah.
hard road.
Right.
You have to have support. I had to have family here to help me drive me to. I was great the days of treatment, but it was the days after that first
Right.
week. You're like, oh my gosh. And then
Right.
I had all my other issues trying to deal with the lymphedema and going to therapy and knowing how was I going to. I didn't biopsy. I didn't do interventional procedures for like a year because the chemotherapy made my feet, they actually turned dark, like they were
Mm-hmm.
dark underneath. And I still have some little tingling, but my hands, I couldn't really use my hands. And then I couldn't open jars or I didn't have a grip.
Right.
And
Mm-hmm.
so I remember being in work one day and one of the lead people in my group was like, hey, Kim, we really still expect you to do breast biopsies. I'm like, and I had a thing of water. I was trying to open it and I couldn't really open it. So, you're sitting with a bunch of guys. I just pass stuff to them when I can't open things. And he opened it for me and pushed it back. I said, so when I can do that, that's when I'll biopsy. He goes, understood.
Right.
he
Right.
he
Right.
didn't get it. I was
Right.
Yeah.
like, I literally
Yeah.
can't even open a bottle of water.
Right.
He was
Right.
like, okay, my bad. Let me pull back. I'm like, I'll let you know when I'm ready.
Uh-huh.
So now, of course, I do everything. I do all interventional
Right.
parts and just put my
Uh-huh.
gloves on and call it a day.
So I just want to go back to this point. You said you had a mammogram 7 months prior to your own
Hmm.
diagnosis. A cancer can develop that quickly.
Yes,
And
that quickly.
and so you kind of think like, oh, I'm fine. It was, I just had one done.
Hmm.
But I think a lesson that we should all take from this is, you know, when your body is telling you something, like you mentioned
Yeah.
that pain,
Yeah,
Listen.
yeah.
follow up on it.
Follow
Listen
up
to
on it.
that.
Right.
You know,
Yeah.
a gazillion years ago, I was in graduate school in New York and my one of my nipples was bleeding. I'm like,
Mm.
what the hell is that?
Yeah.
I'm 20 something years old. Like, what is that? And of
Yeah.
course, I went to the NYU doctors. I found other doctors. I had like my first mammogram at 20 something. Nobody
Hmm.
could ever really pinpoint exactly what it was. And it seemed to kind of clear up. And I
Hmm.
have not had an issue, but it was scary.
Yeah.
Hmm.
And it was also do something about this right now because we don't know
Right.
what
Right.
it is.
Right.
And you did the right thing because that is one of the symptoms of breast cancer is nipple discharge, bloody nipple discharge.
Mm-hmm.
But it
Mm-hmm.
also can be from benign things like just something irritating the lining, like a papilloma, which you may
Mm-hmm.
have had that some reason
Mm-hmm.
they couldn't find.
Mm-hmm.
Obviously, it wasn't anything devastating because
Right.
Right.
it's 27 into your ear now.
Uh-huh.
Right.
But yeah, I mean, listen to your body
Listen to
and
your
don't
body.
ignore those symptoms. And I always say, people say breast self-awareness. They don't do breast self-exams anymore. We don't recommend, American Cancer Society doesn't recommend that, but we do recommend breast self-awareness. That just knows, your own body better than anybody else.
Mm-hmm.
So if you've had nipple changes, like why is my nipple looking crusty or dimpled? Why
Mm-hmm.
does it look pulled in? Or if there's some dimpling of the skin, why does it look like it's puckering in there?
Right.
Or
Right.
one breast is looking bigger than the other one, or why does it look red? Or why do I feel some swelling? And you may feel swelling before you even feel a mass. It
Mm-hmm.
just may feel different, thickened.
Right.
So when you're in the shower, doing the armpit area, you don't want to feel that, but that may mean that the lymph node is enlarged. What is it enlarged from?
Right.
So, these palpable lumps, skin changes, nipple changes, dimpling of the skin, discoloration of the
Right.
skin, all those are signs of being breast self-aware, of signs of that could be breast cancer. So if any of those symptoms do appear, obviously go to your doctor, let them refer you to the nearest breast center so the breast radiologist can evaluate that.
Mm-hmm.
Yeah.
As you can't tell just by looking at something,
And
your skin, you know.
it's better to go. It's
Mhm.
like it's better to overreact and go
Right.
and have
Right.
it checked out.
Right.
Right?
Yeah.
So
And
don't be like,
that's the
yeah,
thing.
you know, and I think
People
people don't.
people don't. I was about to
Mm-hmm.
say people just will not. Their fear has caused them not to have detection at a time
Right.
where they have better options for treatment, better chances for a cure. The fear
Right.
that they may have something inhibits a lot of things, and I think that's the disparity that people always say is like, oh, why don't people go in and what happens with early detection? If you don't go in and address changes in your own body
Mm-hmm.
because of a fear that have been passed down from generations in your family, you know, some people are like, we
Right.
don't like doctors, we don't want to go
Right.
there. Well, we
Right.
can help you, and we can also tell you it's completely benign too, so quit worrying about it. You
Right.
know, but when
Right.
I see this day and age, when I see patients come in and their breast, young patients or even older patients, their breasts are completely deformed, or the breast is there's a huge mass here, and I'm like, we are not near a breast mesh center. You know, we're not in the country, or we're not in the hills of some where there's no access to
Mm-hmm.
Right.
healthcare. It's literally right here. But if
Right.
you don't take advantage of the healthcare that's right in front of you, this is what happens to where it
Right.
becomes where it is not a treatable condition. It's more palliative care. And we're just trying to
Yes.
give comfort to the patient.
Yes.
When breast cancer, this day and age, all types of breast cancer, they are completely treatable and curable. You know, yeah, sometimes it's just a bad player and we can't, even though it's small, or sometimes you don't even find the breast cancer. You literally have, they've taken off the whole breast and like, where's the primary? But they know it's breast cancer based on all the, you know, stains and things they do in
Mm-hmm.
pathology. But it's just advanced, you know, and they're like,
Mm-hmm.
it's a bad player. Or I can
Mm-hmm.
have huge cancers in the breast and it is nowhere. Like it is not in the lymph nodes, it's nowhere metastatic. It just
It's
it's a
localized.
slow growing thing that just sits there and they take it out, they do fine.
Right.
So
Right.
it is a interesting thing how cancer is treated this day and age. But you're 99.9% of the time, if it's small and it's caught early, you can have a cure, you can
Right.
survive, and you can choose your type of treatment that you want, lumpectomy with radiation and maybe some pills or maybe
Mm-hmm.
some IV
Mm-hmm.
medication, chemotherapy. Or you can choose to have mastectomy with reconstruction, which all insurances come pay for these days. So people
Right.
don't have to just have the breast removed and not have a new breast there.
Right.
That's one of the things I guess I should mention. It was interesting. So after the surgery, you know, I took all these pictures of my breast, you know, before I'm
Mm-hmm.
like, anybody finds that disc, I'm like, but something happened to my computer. I hate that. We went to Europe the
Mm-hmm.
next year and I took the whole family and all my pictures are gone. So I have no idea what my native breast looked like. I
Mm-hmm.
had pictures of them. Nonetheless, I'm in the hospital and I wake up and you know, you look down, you're like, oh, it's interesting. That looks pretty good, actually.
Mm-hmm.
Mm-hmm.
Because it's still my skin. It's just, I
Right.
know
Right.
my breast tissue. And I
Right.
had drains and stuff hanging out, but
Uh-huh.
I was like, oh, that's interesting. Yeah, they're not there anymore, but they're new breasts. So,
Right.
yeah.
Now, what has your mental health journey been like during this?
Yeah. So that's interesting because I think my sister had brought it up to me one day. She goes, yeah, I remember they were calling and asking the groups, like, was Kim going to be okay? And I was like, was I acting differently? I guess I was. You know, you don't
Mm-hmm.
know
Right.
that you're
Mm-hmm.
not putting one foot in front of the other. Maybe everybody else sees that you've changed. So I was thinking back in that journey. She just mentioned it to me recently, and I was like, what was I doing? I don't even know. And maybe I was, you know, maybe I was just so tired. And you are still going through that. It's a hard road, you know, it's a
Yeah.
hard journey to do
Mm-hmm.
chemotherapy and to have
Mm-hmm.
complications from the surgery
Mm-hmm.
and trying to work and figure out how am I going to get back to some sense of who I am. I hate
Right.
always people saying the new normal. I'm like, there's no new normal. It just is what it is. I don't know why that angers me. It pisses me off when
Mm-hmm.
I hear new normal. I'm like, what does that mean? No.
Mm-hmm.
How about me? How about
Mm-hmm.
what things happen in people's lives? You just have to find out this is my journey. This is how I'm going to be.
Right.
And
Right.
it's not a new normal. It's just who I am. And
Right.
maybe that is a definition of that. But
Right.
I think for me, it was just, uh, I have to admit, as I say, going back to work was crazy, the full time that I was doing. But I think that gave me the drive to say you can be who you always were. This is a little bump in the road. And then, afterwards you're just like, I want to eat healthy. I want to do everything. I want to travel. You think of all these things that, because life is so fragile. It can just go away like that. And I think in those early years, I was more out there. And even though I was hobbling around the world with my bad feet from the chemo, I was like, I'm going to climb this Tower of Pisa. The kids were pushing me up. Like, come on, Kimmy, you can do it. I was so freaking hot. I was like, Italy was killing me. I was like,
you probably went in the summer.
Exactly. It was like, this is awful. But yeah, we try. I think back, I'm like, well, we had some good times because I was like, come on, kids, let's go through the world. So we did Greece, we did Italy, we did Paris, we just were traveling. And then life somehow catches up to you and you start going back to your old ways of, I really am an introvert. I really am tired.
Right.
I have given all that I have. I'm like, and they're getting older, and I'm like, let's just everybody have their own life. So we were just talking recently that when COVID hit, we had just got back we did a trip. Well, the little one had a school trip to Paris, pure hell. Don't ever do that with kids from their school. They stay in the like cheesiest places, eat the worst food. I'm like, this is not my kind of trip. But we ended up in Spain. And so then we had a nice time there, a nice Airbnb. It was but that was the last trip I'd taken. I mean, COVID hit. That was 2019, and everybody came. The older kids flew over, and we were like, okay, this is it. And then I have not been anywhere. I'm like, that's why I actually was listening to your podcast. You're going to Cuba. For your birthday in August. Cuba. I was like, oh yeah,
and Midland
that
in
would have been so
September.
cool. Oh wow! See, I got to get back out there. I mean, I was like, I haven't been, and I'm like, get back to my old ways. Realize that I enjoyed those things, but life just slows you down sometimes.
So, absolutely. I'm sorry. Go, Candy.
No. I was just gonna ask, what's the take-home message? Is it live each day? Is it get out of your comfort zone? Is it see the world? Is it, let go and let God? I mean, what's your mantra now?
But at each point, all of those were my mantra.
Really?
You get the diagnosis, let go, let God. You survive it, or I guess while you're going through it, you're just trying to survive it. But then afterwards, you're like, what are the things that I want to do? What are the things that I haven't done? Because that's the one thing people always say, when you're laying there and you're sickly, you can't all of a sudden do something like, oh, I should have, woulda, coulda, shoulda. You don't want to be that person.
Right.
But, you got to do it within your means. Don't go overboard. Don't do, just living life to the fullest extreme, because you have responsibilities. It's like, don't go crazy because you got a diagnosis of cancer.
You're still going to have to pay that credit card bill. Yeah.
Exactly. It's like, you got to live within your means, It's like, realize that was a devastating diagnosis and it could have been taken, but it's the same thing if anything else happened. You had any other health issues, or you're in an accident, or you survived a crazy crash or whatever. It's just know that life is fragile. And this is one of the things that can happen. It's like 1 in 8 women are going to get breast cancer. It is devastating news to hear, but it's not the worst news, because this is the one cancer we can actually treat.
Right.
So I'm a big advocate for going out there and telling people, be advocates for others. If you've gone through this journey, make sure you're telling your friends, go out there, get your mammogram, get detected, get it treated, and let's go on. We can be part of the same survival club. We did this. We did this, and don't let it ruin your life. Don't let it be the worst thing that ever happened. Yeah, if you were young and you have young children, you're just like, oh my gosh. But I've also seen those people be the strongest warriors people ever. They are. We have a Panquinette Pink, which is a 5K fundraiser for the hospital. And these women are out there with their families, and they're young. Some people are young. Some people are in their 30s. My youngest patient I diagnosed with breast cancer was 19.
Oh my
And fortunately, I remember her name very well. And I remember we told, they put you through ovarian suppression drugs, and they're like, don't get pregnant, just because her tumor was hormonally driven. back then I was in called a women's pavilion where they had babies too. That's where the breast center was. And I remember seeing her x-ray up, and she had these like granular little nodules all over her breast. I'm like, oh my gosh, why is she here? She got pregnant.
Mm.
The tumor came back with a vengeance. They delivered the baby, also a little girl.
Mm.
She ended up dying over the holidays, and her mother had died of breast cancer at 23. So I just saw like, this is going to relive itself.
Right.
So yeah, I never look at an age so much when I'm looking at, because of that diagnosis. Like when I'm looking at the images, I'm like, what do you see? Don't look at the age. What do you think it is?
Right.
Right.
And just go for it, because I've had a 17-year-old that had like lymphoma in the breast, but it's like, it happens. You just have to characterize it and go for it, biopsy it. Don't say, oh, well, she's young, it's probably nothing.
Right.
Those are the ones
Right.
I see I see patients that OB/GYN has put them on antibiotics because they're like, oh, it's an inflamed, you rule out inflammatory breast cancer before you assume someone has an infection.
Uh-huh.
And those are just devastating when you're like, really? You've been antibiotics for how long?
Oh
And
my gosh.
it's,
Wow.
So I always say, rule out cancer first, then go back and treat your little infection or inflammatory thing or whatever you have going
Your
on.
cute little infection.
Exactly. Don't go there first, but
Right.
they're always like, "Oh, this is a cyst." They call it a lot
Everything
of
is a
people call
cyst.
every mass a cyst. I'm like,
No.
it's not a cyst till I say it's a cyst. When I see
Right.
a fluid-filled sac with my ultrasound probe,
Oh,
it's just a
Now,
mass. It's a lump.
Candy mentioned briefly about your personal mental health. And of course, I think of the things that manifest after a diagnosis like this, like, anxiety, depression, hopelessness. But I also want to point out resilience and perseverance and empowerment and self-awareness. So we often get bogged down in the negativity and that sense of helplessness. But when you see someone saying, okay, this is what's happening, but I'm choosing to be bold and courageous and resilient and utilize support groups or journaling or mindfulness to help me push through this, I think, like, more power to you. And, for that strength and just that fight.
Yeah, I love that, Judy. That was very well said. I mean, it's true. You have to find your own pathway to how you're going to get past all this. And if it's journaling or, mindfulness or just being meditation or being with family and friends, find your pathway that's going to get you through this, because you will get through it. And even if you people live with cancer every day. They say that my mom was like, they're never going to get rid of their cancer, but they have learned to live with it and has still going on every day. So, you can have what they call bone metastasis with cancer in your bones, but nowhere else in your body. It's spread from the breast, 10 years plus, that's a long time knowing that you have cancer in your body, but you're learning how to live with that. You learn how to continue to be a part of this society and not be a recluse and be, depressed and anxiety and hidden from the world. Like, you just get out there and you're like, I have this, I have to do this.
Right.
So, I went out yesterday, I had my sleeve on. One of my friends' sons just graduated from Yale. So they had this party at the house and it was hot. I know it's going to be backyard. So I have I normally don't have it on when I go to friends' houses, but I was like, I can't, I'm going to be sweating up there. So it was interesting. People I'd known for a while, they're like, what's with the sleeve? I'm like, you've never noticed one of my hands is bigger than the other. I just go, oh, it's lymphedema, child. I've had it for 16 years. And I go on. Like, I don't even explain it anymore. I used to go to the whole shebang. I'm like, go ask somebody else. Somebody's heard my journey.
Right.
I'm not going to relive this for you right now. But yeah, I used to not, I not really hide it, but just not try to publicize it as much. But, after a period of time, your own body. You're like, I'm going to be outside. I got to protect myself. So sleeve on. Let's go. Yeah. Yeah.
Well,
And if somebody asks me about it, I call it my, I'm not the scarlet letter, but it's like when I'm out in public, people go, oh, so I'm like, oh, this is breast cancer. Yeah. You know what? I hope you've had your mammogram. And I go through the whole spiel. So when it's a stranger, asking me about it in public, I always go through the spiel of, this can happen, but I'm still here. I'm a survivor. I diagnose breast cancer. That's what I do for a living. So I need you, this is a reminder because you asked me. And they go, oh, I do need to go in and get my mammogram. I'm like, do it now.
Yeah.
And then we walk away. Yeah.
Right.
So
Right.
yeah.
Oh, that's great, Kim. Really great.
Yeah. Wow. Thank you so much for being with us today. It's
You're
been
so welcome.
an education. You hear so much about it, but to actually hear someone's personal story,
Right.
it paints a very, very different picture. And I so appreciate your willingness to share with us. Candy and I, when we end our sessions, we say how we can relate. Whatever the issue is, we can relate. But I'm going to say we can't relate.
Right.
This has not been a part of our personal journey. So I'm never going to try to dismiss that experience
or trivialize your
trivialize by saying I can relate, because I can't. But what we can do and what we will do is empathize with you and any other woman, any other person contending with this. So again, our sincere thanks for just sharing your journey with us and for being with us today.
Right. And giving people hope.
Yes.
That's like the take home message from this is don't hide. There's hope. There's hope.
Yeah. And even though you haven't been through this journey, you have known people who have, definitely known, everybody knows somebody who's had breast cancer, gone through this journey, or gone through the fear factor of I have an issue and it turns out to be benign. It's the same level of anxiety, the same level of, mental questioning in your brain, like what's about to happen kind of question. But I think even though you haven't gone through the journey yourself, being that supportive friend or being an advocate for those to take care of their own health is a continued thing that we all aspire to. So I say just continue to encourage, be you, and make sure that you're taking care of your loved ones.
Yeah. Candy, I think we'll have to re-air this in October for breast cancer.
We will.
We will. Yes.
We'll definitely do
great.
that. Yeah.
Thank you again, Kim. It's been a pleasure.
Thank you
You're welcome. Pleasure seeing you guys. Take care.
All right. Thank you so much for listening to this episode of SOCA. We encourage you to go on your phone, scroll all the way down and rate the podcast. We really need the ratings. Please tell friends about this and follow us on Instagram, Two Sisters of a Certain Age. And we just really appreciate you, and we'll see you next time. Thank you.
Thank you. Bye, everyone.
No Longer Network.